Hi everyone, my name is Gary Davis. Thanks for coming to the presentation tonight. This is called Medicare Open Enrollment, Fine-Tune Your Medicare. The focus of tonight's meeting is really to talk about a couple things. One, changes to Medicare that are going to be changing for 2025, and also the open enrollment season, which we are in now. It started October 15th, and that's a very important time for everyone on Medicare every year, but particularly this year because of the number of changes that are occurring. I'm in the PA MEDI program. I just want to tell you briefly about what PA MEDI is. It's the name of Pennsylvania State Health Insurance Assistance Program. All 50 states have such a program. Each one names it whatever they want. In Pennsylvania, they've decided to call it the PA MEDI program. MEDI stands for Medicare Education and Decision Insight, if you want to know what that is. The purpose of this program is to provide free, independent, confidential insurance counseling to the seniors of Pennsylvania. And in our case, we work through the Department of Aging for Chester County, so we service the Chester County area. The counselors, such as myself, we're trained, certified volunteers. Okay? And that's important from a couple standpoints. I mean, one is we have no financial interest. When you meet with a counselor to look at your options, your plans, things, we have no financial interest in trying to push you towards one product or another because the commission is higher here or that. You know, we get nothing. Okay, we're volunteers. So it truly is, our goal is not to sell. Our goal is to educate, to help you understand your choices and options, the pluses and minuses of those options, so you can make a well-informed decision about what coverage is going to be best for you. We provide services in a number of ways. One is one-on-one counseling, and this is available throughout the year, but particularly during the open enrollment season, we schedule a lot more appointments to be available. We do those at senior centers throughout Chester County. Anytime during the year you want to have a one-on-one with a counselor, you can just call up your local senior center. In this case, if you live in the area, the Phoenixville Senior Center would be closest. And we don't have counselors there every day, but each senior center knows when they're going to have counselors there, and they schedule those appointments. We can also do counseling on the phone or Zoom if that's needed. We do a lot of counseling during open enrollment and sessions like this because that is such an important time. You don't want to miss it because not looking at your plans every year can end up costing you a lot of money. We also assist low-income beneficiaries. There's a lot of programs, federal, state, that can help reduce costs for prescriptions, for medical co-pays, etc. If you meet certain income and resource guidelines, and we help those who are eligible get signed up for that. We also do a number of presentations throughout the year, mostly at libraries like this throughout the county. The one we do most frequently is called Medicare 101. That's for those who are going to be new to Medicare, explaining what Medicare is, how to sign up, etc. Okay, let's talk about some major changes for 2025. One, there's going to be a cap for out-of-pocket costs for prescription drugs of $2,000. Okay, that's not for the premium for your plan, but this is the actual co-pays and deductibles when you're picking up prescriptions. There is no longer going to be called the donut hole or the coverage gap. That is gone. Okay, for those of you who may have been aware of what that was, after you spent a certain amount on drugs, a fairly high amount, you would go into what's called the donut hole, and typically what would happen is your co-pays would go up. Okay, at that point, that's gone. And there's also a prescription payment plan for those who need that. Talk more about each one of these. The first one, let's talk about the $2,000 out-of-pocket cap, which is the most significant change. This includes deductibles and copays, so as you're picking up prescriptions. It does not include the premiums. Many of the drug plans have a premium to pay. That doesn't count towards the $2,000. In 2024, this year, the maximum out-of-pocket was about $3,300. So if your copays this year hit about $3,300, you would then go into what's called the catastrophic phase, and your copays would be zero for drugs for the balance of that year. So that 33 number is dropping down to 2,000 in 1 year for 2025. That's a big change, okay? And that's going to save a lot of people a lot of money. It only applies to drugs that are part of your plan's formulary. Every drug plan, whether it's a standalone drug plan or one in a Medicare Advantage plan, either way, they all have a formula. That is the list of drugs they cover. None of them cover every drug that's out there. Okay? So in looking at what plan you should have for 2025, you certainly want to make sure that all the prescriptions you're taking are covered. Now, there are some really expensive drugs that no plans cover out there, but hopefully those won't apply to too many people. And again, the donut hole for those who were affected by that in the past, that is gone. The next thing is a prescription payment plan. This is voluntary. No one has to do it, but it's a way, many of the drug plans have a high deductible. For example, like $590 can be a deductible in 2025. So many people's cost is very high in the first quarter because they're meeting that deductible. This is a payment plan that would allow anyone who wanted to sign up to stretch out their payments over the course of a year to avoid a lot of spikes early in the year. Anyone who wants to do that, they would sign up not with Medicare, but with the insurance company who's managing their drug plan. Might be Humana, might be WellCare or Aetna, whoever that is. You'd sign up directly with them. Here's an example of how such a payment plan might help someone. On the left, you see, without a payment plan, Juan's drugs cost are $500 per month, his copays. And after 4 months, he's hit the $2,000 maximum. So he can still get his prescriptions filled the rest of the year, but it's zero copays for the balance of the year. He's hit the $2,000. If that $500 a month for the first 4 months was a strain, he could sign up for this payment plan option, okay? In which case it kind of stretches your dollar amount over the course of the year. There's kind of a very detailed calculation, so it's not the exact same the first few months. It's a few things go in that. But a couple things to remember, it all comes out the same. The payment plan does not save you money. Okay, you'll pay the exact amount. The only thing it does is stretch out the payments over 12 months to perhaps assist in your cash flow. There's several other scenarios here. I'm not going to bother to go through all those. Just the takeaway tonight for this is the payment plan option exists. It won't save you money, but it'll spread out your cost if you need that. And you'd sign up directly with the insurance company who manages your drug plan. Any questions on that? Okay. Now we've got a great small group here, so anytime you have a question, just raise your hand and shout out, okay? So the consequences of these changes, particularly the 2,000 cap. This provision to reduce it to 2,000 was part of the Inflation Reduction Act that passed, I don't know, a year and a half ago or 2 years, I forget the exact date. It had quite a bit of impact on prescription drug costs. Some phased in already, including lower copays for insulin at $35 a month. This is this 2,000 limit is phasing in 2025, and there's other provisions that will help save cost in 2026 that allows Medicare to negotiate the prices of some of the most expensive drugs, which again that'll kick in next year. But with all these changes and with Medicare repayment being constrained a bit, there's a lot of pressure on the insurance companies, okay, that offer these plans, that offer the Advantage plans. They're getting squeezed a bit, okay? So what you're going to see is some of the changes in plans that are coming out this year are their reaction to that, to try to manage their profitability the best they can. One of the largest Part D drug providers called WellCare. I don't know if anyone has a WellCare drug plan, okay, but part of their reaction to this was they sent a letter to all insurance brokers throughout the country that handled their product and said, we're terminating all agreements. We're not paying any insurance agent to sell our products. So if you have your annual review done by an insurance agent every year who helps do that for you, find the best plan and enroll you, if the WellCare plan is the best plan for you, they may not be able to enroll you in that. They may need to tell you how to go do it. but that's one of the reactions that's happening to the insurance companies trying to manage their costs better. One of the other things is some of you may have a prescription drug plan through an employee retirement plan instead of a regular Part D plan. If you do, this would be a good year to look to see if it's advantageous to stay in the employer plan or to switch to a Part D Medicare plan. With that $2,000 limit that the Medicare plans have, you know, it might be better. It's certainly worth looking if you currently do have an employer or union provided plan. So one of the big takeaways here is every year during open enrollment, people on Medicare should reevaluate their plans. If you know how to do it yourself on Medicare.gov, that's great. If not, we really encourage you to either work with your insurance broker or to sit down with a PA MEDI counselor. We have lots of appointments available throughout the county, at the senior centers, at libraries, at various places. It normally is about an hour session. We can look at your drug plan, your Advantage plan, whatever you have, update your drugs and see which plans are going to be least costly for you, help compare the different options that are out there. Again, if you'd like to do that at the senior centers, just call the senior center directly. They do the scheduling for their facility. If you can't get an appointment at the senior center or want to get one of the appointments at the libraries or other places throughout Chester County, this number is our general number to call for scheduling appointments at other than senior centers. Okay? And they'll tell you, depending what days you're trying to schedule an appointment, what sites might be available. If you do set up a counseling session with us, the things you want to bring so it can be a productive meeting is bring a current list of all your medications. Okay? What you take, the dosage of it, the strength, all that. Bring all your insurance cards, your Medicare card, your prescription drug card, if you have an Advantage plan, your Advantage plan card, supplement cards, anything like that. It's also a good time to bring any mailings. There's a lot of mailings that go out this time of year. If you've gotten some mailings that you don't fully understand, bring those in. We can help you sort through those. The other thing that's very helpful in doing these reviews is if you have an account set up on Medicare.gov, it makes the process go much quicker, but bring in your username and password so that you can log into your account while you're there, because all your prescriptions are already in your account, so it saves time loading those in.
Is that only once you're enrolled that you can set up an account?
Yeah, you have to have a Medicare number. So are you enrolled yet, or? Oh, okay. So you may want to attend our Medicare 101 presentation,
yeah,
will help you, which explains how to enroll and all that. So again, this is a very important time of year when you can change your plans. And even if you're happy with your plan, even if your drugs haven't really changed much, it's still important to sit down and review because the insurance companies are changing the plans. They change every year, okay? Even though your situation may not change, they're changing the plans, okay? And this year, because of some of the changes we talked about, we're seeing more changes to plans than we normally do for the coming year. Open enrollment is the same dates every year, October 15th to December 7th. And any change you make during that period becomes effective January 1st of the coming year. Okay? Please don't wait to December 6th or 7th. You won't be able to get an appointment if you wait that long.
It's like waiting until the last day of the month to get your inspection done on your car.
Exactly.
That's exactly
yeah.
what I meant.
Yeah, or trying to do your taxes on April 15th, you know, I mean, it's welcoming problems. There's a lot of notices that can sent out this time of year, which they're important notices, and you want to make sure you've gotten them and read through them. One is an annual notice of change. Whether you have an Advantage plan or a Part D drug plan, all the insurance companies are required to send you this annual notice of change to highlight the changes they're making to your plan. Okay? This is the one I got from my Part D drug plan. For those on Medicare, did you get your annual change of notice?
I guess Yes, I did, I just didn't open it yet.
Okay?
Is it only for Part D or is it for?
No, Advantage plans too.
everything?
Okay? So, everyone's required to send these out by the end of September, okay, all the insurance companies. So, you know, it may have just looked like, you know, junk
Junk mail.
sales mail,
Oh,
okay? But they're important because they do highlight the changes to plans. So for example, in here, it tells me that the premium for my drug plan is changing. In this case, it's going from 50 cents to 0, so I was okay with that change. The deductible is going up, and those are the primary changes. They touch on a couple other changes in all these that are sent out, and they don't go into detail here, but rather refer you to their websites or Medicare.gov. Yes?
Are you, I have worked up a sweat in past years with the drug changes. I mean, and then I just went nuts trying to, it's letting go of the old one and hoping that the new one works, you know?
Yeah.
So you're saying if I have this number I can call and get, somebody could help me and walk me through?
Absolutely, absolutely.
God.
That's what we do. That's what we do. Bring in your list of meds, bring in your insurance cards. What we do, there's a great tool on Medicare.gov. You can go in and play with it yourself, but there's so much information there, it's easy to get overwhelmed.
Well, apparently
Okay?
I've never found it, so.
That's okay, that's okay. You'll see the counselor use it when you meet with them, okay?
Oh,
And we
I'm
go
gonna
in
do that.
Medicare.gov, we enter your medications. Again, if we have your login, we're gonna be able to get them real quickly from there. And we update it, make sure it's an accurate list of meds. And then we pick pharmacies as the next step, what pharmacies you wanna look at. And then it compares all the plans available in this area and ranks them on which one's going to be least cost in order down to the most expensive. So once you get the data in with your meds, it's very easy to see this plan is going to be the cheapest for me. Very easy. Now, there may be a reason you don't want to pick that plan, and so we kind of drill down, look at the details. What are the pharmacies that you can go to with that? Maybe you don't want to change pharmacies, you know. So it's, sometimes you don't go with the absolute lowest one, but it's an excellent tool that makes the process easy. A couple of things that you're not going to get the details in here that are very important is change in preferred pharmacies, okay? I'll talk more about preferred pharmacies in a minute, but it's important to know which pharmacies are preferred for your drug plan. And they change those, but they don't tell you here, it refers you to the website, or Medicare.gov has it. The other thing they don't have in here is their formulary of drugs they cover, and that's changing too. Now that would be too big, everyone would get a booklet like this if they included that. So, but again, they do drop drugs, okay? So you may have a drug that's covered that they're dropping for 2025, okay? You wanna find that out ahead of time and make changes. A couple other forms, evidence of coverage. If you have a employer plan, retiree or otherwise, you're probably gonna get a form just documenting that you've been covered by a plan. And the Medicare new booklet comes out every year. I saw, yes, you have yours for 2025. They're really a good booklet. They're well indexed and it's easy to look stuff up. You can also just have that available online. It's all the information's in Medicare.gov. Some of the other mailings, not as many people would receive these, but they are going out this time of year. Some plans are leaving the Medicare program. You might get a letter to that effect, that you have to change because we're out of here, okay? Talk about Part D drug plans. For 2024, there's been 20 plans available in Chester County to pick from. For 2025, there's only gonna be 14. 6 plans are gone, okay, that they're pulling out. 3 of them belong to Mutual of Omaha. Mutual of Omaha, if you had their drug plan, you're gonna get a letter that's saying, we're out, we have no other plans available for you in Pennsylvania, you need to go do something else, okay? Which is fine, just need to meet with the counselor, we figure out the best plan and enroll you in a new one, not a big deal. The other plans that are going away for the Part D ones, there's 2 Aetna Silver Script plans. Those are very popular plans, okay? Aetna has 3 called Silver Script. And 2 of them are going away. And there's also an United Healthcare AARP plan going away. So anyone who has those should have gotten letters by now, and they would say, your drug plan's going away. However, being the nice insurance company that we are, we're just going to automatically put you in one of our other plans, okay? Don't be too thrilled about that, okay? They didn't do any exhaustive study to figure out which plan's gonna be best for you. They took everyone in that plan that they're doing away with and just wholesale put them in another plan, hoping they would stick and stay with that company. So don't be complacent that, oh, I'm still in another Silver Script plan or AARP plan, so I must be fine. Very important to sit down and review the options. There's also a program called Extra Help. It's a federal program that helps with prescription drug costs. They send out a letter every year to anyone who's qualified, just reaffirming if they will remain qualified for the coming year and what their co-pays will be. Also, Social Security sends out letters this time of year to people if they have certain high income. If you're over certain thresholds, you pay higher amounts than the normal amount for the Part B premium and Part D premium. Okay? And those letters are going out now as well. So it's easy to miss some of these letters because there's also a lot of sales literature going out this time of year trying to get you to look at their Advantage plan or their supplement plan. So you really need to kind of weed through it carefully. Another question that comes up this time of year is, what about those ads we see on TV with Joe Namath and Jimmy Walker and what have you? You know, are they scams? Are they real? Are they too good to be true? They're not scams, but a couple years ago they really got misleading, I will say. Not that they were lying, but it was misleading or incomplete information. So Medicare passed some new regulations that any such advertising now has to be approved by Medicare before it goes on the air, which will help. But again, the thing when you see these ads, what they're promoting are mostly Advantage plans, which is fine, but they're promoting the Advantage plans with the most possible benefits, okay, to get your attention. You know, including grocery allowances and money for utility bills and all this stuff. There are some plans like that that exist. But those plans with those kind of extra benefits are only for people who are what are called dual eligible, meaning they're eligible for Medicare and they're eligible for the state's Medicaid program. Medicaid is for people with lower income and financial resources. The state helps them with health insurance costs. So these ads are playing out to everybody, but they're really only applicable, the product they're particularly focusing on is only applicable to a small percentage of people. But they're hoping you'll call up and they'll redirect you to another product that they can sell you. So just be careful of those ads. And obviously you're calling an insurance broker somewhere in the country, who knows where. There's a lot of good insurance brokers in Pennsylvania, in this area, and as well as PA MEDI. So you may just want to try to get in touch with someone local to sort your options out. I want to touch on this slide for a minute. It covers a couple things. This shows you one of the fundamental choices anyone on Medicare has, that is how to get your Medicare benefits. There's 2 choices. The left side of this is called the original Medicare choice, and the right side is Medicare Advantage. Either side, you're on Medicare, you're getting your Medicare benefits, okay? But they are different. On the left side, the original Medicare side, there's no networks, okay? You can go to any doctor in the country that takes Medicare. So if you want to see a specialist at the Mayo Clinic in Minnesota, your coverage is as good there as it is here in Chester County. You can go to any hospital in the country, no networks. If you have original Medicare, you have the option to purchase a Medigap plan. They're also called Medicare supplements, same thing. And those are plans you pay a private insurance company a monthly fee to have. And with those, this plan covers most of the Part A and Part B deductibles and copays. So if you're hospitalized, you won't have to pay the $1,700 hospital deductible. Your supplement picks that up. It picks up most of the those costs that Medicare otherwise would pass on to you. Medicare was never designed to cover 100% of cost, and it doesn't. And then the last piece here is if you have original Medicare, you need to get a prescription drug plan. And that's what we're talking about. There's 14 going to be available in 2025 to pick from. So during open enrollment, if you're on original Medicare, the main thing you need to look at is taking a look to see if there's a better drug plan for you. Okay? And again, easy tool to do that. If you have a Medigap plan, you can also shop that to see if there's insurance companies who offer one at a lower price, things like that. But the Medigap plans can be shopped anytime during the year. They're not subject to this October 15th to December 7th. So you can certainly do it this time if you want to, but those can be shopped anytime during the year. The other thing you could consider if you're original Medicare, you could consider changing to a Medicare Advantage plan during open enrollment. That's fine. There's no medical underwriting to go to a Medicare Advantage plan. You could do that if you so choose. If you did that, and if you had a Medicare supplement plan, you would have to give that plan up. You're not allowed to have a Medicare supplement plan if you're on this side. Okay? Yes?
I'm a disabled veteran, is that, and I go to the VA for my medical stuff. So that's considered my Medigap plan? Is that what that is? Because you have VA there, and I'm just wondering if
Yeah.
that's what that is.
Yeah, so with VA, depending on your situation, I'm not a VA expert, okay? But you can have and use both Medicare and VA,
Right,
but not for the same things.
okay.
So for the things that you decide to go to the VA for, then that's your VA benefits covering you.
Right,
You may decide to go not to VA doctors or hospitals for other stuff,
right,
okay? And that would be Medicare covering you. So you can have both, but the two don't cover each other.
right.
Okay.
So it's possible for me to get the Medicare Advantage plan even though I have the VA benefits, as long as I didn't try to use them both on the same one.
Yeah, right.
Okay.
They're both not gonna pay for the same thing. It's
Right.
which way you go, because you don't have TRICARE for life, right?
No,
Yeah.
well, it's not TRICARE, I'm a disabled veteran 100%,
Gotcha.
so it's not TRICARE, I think it's Optum now,
Oh,
if they
okay.
send me out to the Community Care Network.
Okay.
But the reason I'm looking at this is because I'm getting frustrated with them not listening and not looking at what I feel is a problem. So I'm like, okay, I'll go to the Medicare side, but I have no idea what I have or anything, so.
That's where you'll wanna sit
I'll
down.
need
with
a one-on-one,
You'll need a
yeah.
one-on-one. But yeah, you have those two paths available to you, and you
Okay.
can, you can use them both.
Okay,
Let's talk about Advantage plans. If you have an Advantage plan, again, you need to look at it during open enrollment. Okay, you need to look at the drug cost. What's the cost in your Advantage plan versus other Advantage plans? I mentioned there's 14 drug plans in Chester County to pick from. There's 78 Advantage plans. Okay, it's crazy. I mean, that's like the cereal aisle at Giant. Too many choices. But so you really need to compare what are the co-pays from the different plans. You know, the doctor's co-pays, the specialists, the hospitals, hospitalized, what are the drug costs, what are the extra benefits? Advantage plans offer some extra benefits like dental and vision, hearing, over-the-counter allowance. How do those compare from one plan to another? And the most important thing, if you're looking at changing these plans, is who's in the network. These are all network-driven plans, meaning they have doctors, hospitals, physical therapists, everything that have agreed to be part of their plan in their network, okay? In order to maximize your benefit from these plans, you primarily need to use people who are in the network. Some of the plans you have to use people who are in the network, or you won't have any coverage. So most people our age aren't looking to change doctors at this point. So key due diligence, if you're looking at changing Advantage plans, is are my doctors in these plans? All my doctors that I go to. Are the hospitals I would want to go to if I had to be hospitalized in their network? Okay? Take some due diligence.
So even though there's 78 plans, there's still only 14 drug plans, correct?
Correct.
Either side.
Well, there's 14 here,
Right, but what?
okay? And there's 78 different plans here, But for example, Independence Blue Cross, Philadelphia, they have about 10 different ones. Aetna has probably 10 different ones. So, like Aetna has all the same drug plan in all 10 of their plans.
Oh.
Okay, Independence Blue Cross. So there's not so many different drug options.
But there could be more than 14 on that side.
Yes, could be. Okay, so that we mentioned that they make changes every year, and this is true of standalone drug plans or the drug plans that are in Advantage plans. Okay, they can change the drugs they cover, the formulary, premiums, copays, deductibles, pharmacies in the network, preferred pharmacies. I said I'd touch more on that, so I will. It's important to know that with most of the drug plans, not all, most, they have preferred pharmacies, and then they have regular in-network pharmacies. You can go to either one. The plan will be honored there. But you typically want to go to the preferred pharmacies because that's where they've negotiated preferred pricing, and you're going to have lower cost. Okay? So if you have a drug plan, you should know who the preferred pharmacies are. And then the other thing, again, we can do this as we're looking at plans for you. Not all preferred pharmacies are going to have the same price. So it's not unusual for a Part D plan to have CVS and Giant and Save-On and Acme or something. They have multiple, not just one preferred pharmacies. When you look at the cost detail, sometimes the cost in the different pharmacies is pretty close. Sometimes there's significant differences from one to another. So again, through the analysis, we can help you pinpoint the preferred pharmacies for a particular plan and which of those would be cheapest. And of course, they can change the tiers of drugs every year. So a lot of moving parts. Medicare sets a deductible that no one can exceed for Part D plans, and this year it's $590. It was $540 this year, so it's up $50. So the deductibles will be higher in most plans. Not all plans have deductibles. Again, a big change is the $2,000 cap, and then you go into the catastrophic where you pay $0 for the balance of the calendar year, and then January 1st, that clock starts all over again. Okay? This is some change for anyone who qualifies for the federal program called Extra Help, which you have to have income and financial resources below certain levels. The change here is anyone in this program would be allowed to change their drug plan every month of the year if it was advantageous to them. I can't imagine the scenario where that would be advantageous, but I think what they're trying to get at is if during the year you're given a new prescription and maybe that prescription is not in the formulary of the plan that you have. If you're in the federal extra help program, you would then be able to immediately change drug plans to one that hopefully did cover that prescription, which would be effective the first of the following month. So probably doesn't apply to a lot of people, but it is an important new change as well. This was also a change which took place over a year ago, I guess now, from the Inflation Reduction Act, and that is a reduction for copays for insulin drugs down to $35 a month, and with no deductibles applying to those copays. Okay, so that was a nice change as well, and it also applies to insulin that's delivered through insulin pumps as well. Medicare covers a lot of vaccines. Okay, some are covered in Part B, which is the outpatient part, seeing doctors, things like that. Some are covered under Part D, your drug plan. How they decide which ones are covered under which part, I don't know, but the key thing is that they're covered. With prescription costs, I think everyone knows generics are going to be cheaper, so if you're taking brand name drugs, you may want to check with your doctor to see if generics are available or may be available soon. I already talked about preferred pharmacies and how important it is to understand who your preferred pharmacies are and which ones are going to have the lowest cost. And when we sit down and go through a review with someone, we also look at mail order cost. Sometimes mail order can be less expensive. Sometimes mail order can be more expensive. Until you plug the numbers in and see how they fall out, You just don't know. On the mail order, I just took, I already did the analysis for my wife's plan for next year. And we deal with, you know, pharmacy nearby, retail pharmacy, we don't use mail order. But as I was doing her analysis, she has one brand name drug that's a bit expensive. And we found out that if she did that one drug through mail order, we'll do the rest of her meds locally like we always do. But we're gonna do this one drug through mail order, and it's gonna save us about $600 for the year.
Wow.
Nice.
So, is it crazy to have to kind of mix and match? Okay, we'll do this one through here and.
Sounds like it's worth it.
And I had a client that I was helping the other night, and same situation. There was one drug that was an anomaly for some point, and so that one drug, she's going to fill at a separate pharmacy from where most of her
Yeah.
drugs are filled.
Huh.
You know, it's crazy, but that's the drug system we have to work with. So we got to maximize our understanding of it and take advantage of it. These are some other resources with prescription drug information, you know, including manufacturer assistance programs and others if you care to look at them. The one thing I'll mention is GoodRx. That's an app. I don't know if any of you have that on your phone or anything. So when I get a new prescription, I mean, I have GoodRx on my phone, and if I'm having a new prescription filled that I haven't had before, well, they're filling it. I'm looking it up on GoodRx, and to see how much it costs using that. And if they come back and say, here, per your drug plan, that'll be $24, and on GoodRx it says 15, you know, I just show them the GoodRx app, and they go redo their paperwork and charge me 15.
Also
So-
ask them about their own drug plan, because I've gotten Acme to give me better than GoodRx.
Is that right?
Mm-hmm.
Hadn't heard that. I'll do that. Changes for Medicare Advantage plans. So with the Medicare Advantage plans, all the changes we talked about with the drug plans, those apply, okay, for their drug piece. But the Advantage plans also have the healthcare piece, to see doctors, hospitals, all that. And those parts can change too. They can change the deductibles and copays. They can change the monthly premiums. They can change hospital providers, doctor providers, and those provider lists are always changing. You know, so you really want to just double check, make sure your providers, your doctors are still going to be in a plan, whatever plan you're going to select, because those are moving parts too. And they change their the extra benefits, the dental, vision, hearing. So the Advantage insurance companies, they're under pressure too. Okay, what we're seeing this year for the 2025 plans, we're seeing some introduced deductibles that they haven't had in the past for health coverage as well as dental. We're seeing them start to reduce the amount of those extra benefits. Okay, not eliminate them, but the past few years the insurance companies have been battling fiercely to try to get members in their Advantage plan. Okay, Aetna versus Independence, Blue Cross, and Humana, and that's why there's all the advertising there is on these. But now they've kind of realized that as reimbursements have gotten tougher, they've got to focus more on profitability and less on membership numbers. Okay, so some Advantage plans are pulling out of markets. We won't see a lot of that around here, but in other markets in the country, some are pulling out. It's just not profitable for them. In here, well, we still have 78 plans. 6 plans I think were eliminated this year. Now another 6 or so came on. Okay, so the total number actually increased a couple, I think. But for the first time, those extra benefits are being pulled back some. So if you have that plan and compare the 2025 to 2024, you're probably going to see some things, maybe a lower cap on the amount they'll pay for dental, maybe a smaller quarterly allowance for over-the-counter. You know, each company decides how they want to price their product. But they're all kind of in the boat of starting to figure out how to give less away and charge a little more. Speaking of Medicare Advantage plans, anyone who has a Medicare Advantage plan has an additional open enrollment period that most people don't know about, but it runs from January 1st through March 31st. And during that time, if you have an Advantage plan, you have an opportunity to get out of it and go back to original Medicare if you want to, okay? Or you can make a one-time change to another Advantage plan. I've been doing this counseling for about 9 years. I've only had 2 clients ever exercise their change during this first quarter at Medicare Advantage plan, open enrollment. And it's really for folks who made a mistake, okay? In both cases, what happened, they enrolled in an Advantage plan during open enrollment to be effective January 1st. And after January 1st, when they called their doctor to make an appointment, that's when they realized their doctor was not in the network, okay? And they didn't want to change doctors, so this get out of jail free period allowed them to change and get back so they could continue to see their same doctor. This is Medicare.gov. If you haven't explored it, there's a lot of information on this site. Encourage everybody who has Medicare to sign up for a Medicare account. Again, this can help speed up the review process when you meet with a counselor. If you go up and hit in right that corner login there, hit the login button, it's going to bring you to a page where you can either log in if you have an account or create an account. So the creating an account is setting up the username, password, security questions, all that kind of normal stuff. But in there, once you have an account set up, you can see exactly what your coverage is. Your drug list will be maintained in there. You can see the notices as bills go through. So you can check to see what am I being billed for, is that proper, did I have that service, and check anything like that as well. And the tool that I was talking about that we use, and you can play with too if you want to, is actually under Health and Drug Plans. And then the pull down from that, it says Find Health and Drug Plans. And it'll take you to a place where you can start entering your drugs, pick your pharmacies, etc. Certainly can play with that. As I said, there's a lot to it. Strongly suggest if you haven't used it before to sit down with a counselor and walk through it. That's what I was just talking about with the online account. Medicare supplement insurance. I want to talk briefly about this. This was for the people who have original Medicare. You know, can purchase a Medicare supplement insurance to pay their deductibles and copays. There's 2 plans, C and F, that are no longer available. There's about 11 different supplement plans you can have, and they have letters for names, okay, instead of names. Plan A, B, C, etc. So C and F were essentially closed as of January 1st, 2020. So you had to be 65 prior to that date to have a C or an F. And they periodically do change the plans, close them, maybe create a new one. So for those who have C and F, even though it's closed, you can have that for the rest of your life. Okay, it's not good, you're grandfathered into it, you can always have it. But just because you can have it for the rest of your life doesn't mean it's the best thing to have for the rest of your life. And there's some concern that the C and the F plan have seen and may continue to see higher annual increases in their premium than the plans that are currently available to everybody today. And the reason is, I mean, just think about the insurance pool. That pool closed in 2020, okay? No one knew, those young 65-year-olds could not come into that pool anymore, okay? So that pool's getting a year older, a fully year older every year, plus X percent of people pass away every year. So that pool is getting older faster and smaller faster than the pools for the actively sold plans. So if you do have a CRF, I'd suggest talking with a counselor, looking at pricing to see if it may make sense to switch to a G or an N, which are probably the 2 most commonly purchased plans today and don't have those issues because they're not closed. With either original Medicare or Advantage plans, you may run into a situation where something is denied. You want to have a certain procedure, you want to get a certain drug or something, and the service is denied. You do have a right to appeal, okay? And you actually have like 5 different levels of appeal you can go through if you want to continue that process. Key thing is to read the denial letter that you get carefully. It'll explain your right to appeal and how to appeal. We can help you with that if you need help. But important thing is, for each level of appeal, there are specific deadlines. So if you miss the deadline, then your appeal is not going to be heard. So pay attention to how to do that and the dates carefully. How to protect yourself. I mean, in today's world, this is common sense, I think, but you want to protect your medical identity as much as you protect your Social Security and financial identity and bank accounts and all that, because Medicare fraud is a huge, huge business. You know, don't give out your financial information only to those who are providing, you know, medical services to you. Protect your Medicare card like you would other important information. And don't fall prey to the free services, okay? Yes, you can have a free back brace. All we need is your Medicare number, okay? If they're asking for your Medicare number, it's not free, okay? Or someone calling you on the phone that can send you this brace or that thing or whatever, and it's free. Just need your Medicare number. Hang up, don't talk to them. If you do run into any situation where you think Medicare fraud may be occurring, maybe as you look at your summary notices of bills that are going through on your Medicare account or anything else, there's a group called Senior Medicare Patrol, and you have a copy of the slide, so that's the phone number. Their focus is Medicare fraud. So you could call them, share with them whatever occurred that you saw that might be fraud, and then they can take it from there. Now, with all that being said about protecting all your medical information, it's also very important to share your medical cards, where your medical paperwork is, etc., with someone you trust. Spouse, family member, lawyer, you know, someone. Because none of us know when all of a sudden we may be incapacitated and not be able to retrieve that information and get that information. And there's a form that you can file with Medicare, which I think is a good idea for most people. You can see the form number here. And it's called Medicare Authorization to Disclose Personal Health Information. So you fill that form out and get it to Medicare, and then that allows them to talk about your Medicare information with whoever you designate. So, you know, I'm on my wife and she has mine, so that, you know, if she needed to contact Medicare, they would talk to her, whereas if you just call up and say, I want to talk about someone else's Medicare account there.
And you can file that whenever, it doesn't have to be during the enrollment period?
No, anytime, anytime. And on there, one of the choices that you can make on there is how long you want that in force. It could be indefinitely until I cancel it, or it could be for a specified period of time, you know, 3 months, a year, whatever you want to do. Help for low-income individuals. There are a number of programs, as I touched on earlier, federal and state have programs to help people with limited income, to help pay for prescription costs, Part B medical premiums, medical co-pays, a variety of different programs to help with almost any of the costs that we've talked about tonight. The program that has, most of them look at income and also financial resources. But there's one program, Pennsylvania's PACEnet program, and PACE, that only looks at income. That can help with prescription drug costs. So if you know someone who's over 65, this is an over 65 program, and has income less than $33,500 if they're single, or $41,500 for a couple, then they would, if they're under that, then they would qualify for the PACEnet program. And that's a program that the state has, is paid for by lottery proceeds. Okay? And it helps reduce the cost of copay. So if you were eligible for PACEnet, you would never pay more than $15 for a month's supply of any drug. So we're talking brand name drugs that can be hundreds, even thousands of dollars a month. If you're eligible for PACEnet, it would be $15. There's another program called PACE, which works the same way, just has a lower income limit, and that limits the co-pays to $8 for brand name drugs. So If you know anyone who, you know, perhaps may meet those guidelines, really encourage them to meet with a PA MEDI counselor, and we can help see if you qualify, and if you do, how to enroll. Okay, just a reminder slide about how to get in touch with us, with PA MEDI. Again, we're here, free service to help you. During open enrollment, you can call the senior center directly for an appointment, or you can call our scheduling number, 344-5234. That number, they schedule the non-senior center locations where we'll have counselors. This is our helpline, which is available all year long. You may have a question anytime during the year about Medicare, maybe something about a claim, maybe something about a letter that you got, you don't understand. Call this anytime. You'll just leave a message, okay, and a counselor will get back to you within 24 hours, normally the same day, Monday through Friday. You can also email your questions if you have, if that's your preference. This is just a couple, it's a slide that has a couple other websites that, you know, if you really want to get into the weeds on some of the stuff, you know, there's more information here on healthcare and some of the programs that I talked about. The Extra Help Program, for example. And the last slide is just a little advertisement from the Department of Aging. As I mentioned, PA MEDI counselors are all volunteers, and the department uses volunteers in several other roles, including at senior centers. So at some point, if you're looking to get involved in some volunteer activities, please keep the Department of Aging in mind as one possibility. So with that, I'll open up to questions on anything we talked about, or anything else for that matter.
Do you work, if we call that number, which I'm going to, do we get you, or?
Well, there's about 35 of us counselors, so, yeah, so you may get me, or,
Okay,
but
gotcha.
anyone you get, I'm sure will do a good job for you. Yes?
So with the drug plans, like, I'm not on Medicare yet, but I'm 65, and I go to the pharmacy and everything I have is generic. It could be $10 one time, next time I go in, it could be $3, because the PBMs set the prices. Does that change with Medicare, or is it always that rate for the year?
It's always that rate for the year. So a typical example with the drug plans is there'll be a schedule, and I'll just use the schedule on this plan right here, by tier. It tells you by tier. So the generics, there's typically 2 tiers, tier 1 and tier 2. Tier 1 are the cheapest. So with my plan, a tier 1 drug is $0 for a month, and a tier 2 generic is $5 for a
And
month.
that won't
That's going to
change
be the
for the year.
same all year long.
Okay.
Okay. And same thing with level 3. Level 3 is a percentage, not a fixed dollar amount. But yeah, so it's going to be consistent throughout the year. Anything else? Yes?
Sometimes in the middle of the year, you're put on new medicines, and also, if somebody is picked up by an ambulance in the middle of the night, do you address ambulance costs, or is that separate? I don't know how to ask the question.
Yeah, well, you asked 2 questions there. So let me take the first one first, which was you get a new drug in the middle of the year. Okay, so that, you know, that's going to happen. So hopefully that new drug is covered by the drug plan you have. Every drug plan has to have, in order to be a Part D drug plan approved by Medicare, it has to have a wide list of drugs available, and it has to have X number of drugs available in every certain category of drugs that they define. Okay? So odds are if you get a new drug, it's probably going to be covered by your plan. Okay? What if it's not? Okay? If it's not covered by your plan, you could ask the drug company, that insurance company, for an exception to go ahead and cover that for the year. Okay? They may or may not do it. You're going to need documentation from your doctor, basically certifying that this is the only drug that's going to work. So if there's 3 other drugs that kind of do the same stuff, and the insurance company covers those other three, they're gonna want you to try these first, okay? If they don't do it, then maybe we'll approve that. But I know a number of people who have gotten exceptions, you know, during the year for drugs. But it does take help from your doctor to justify that that is the one that you need to take. The other thing is with ambulances, Medicare covers ambulance. It's covered under Part B of Medicare. Medicare pays 80% on Part B, so you'd be responsible for 20. If you had a supplement, it would pay for that. If you had a Medicare Advantage plan, you're gonna have a copay. But the key thing with ambulances is it needs to be medically necessary.
And what's that definition that you're about to expire?
Uh,
I've heard,
Yeah,
no,
so
I've heard.
that's often where the confusion comes in, and the
It
billing
is
issues.
Confucius.
You really didn't need an ambulance, you know, I mean, so Medicare may say, no, you know, or the Advantage plan may say, no, you know, we're not gonna cover that. You know, that was for your convenience, we think not a medically necessary thing. If it's clearly medically necessary, you know, you had a heart attack and you're laying on your kitchen floor, that's gonna be medically necessary, and there's gonna be no dispute. Medicare's gonna pay 80%, and you know.
At one time, sir, I thought it was only if you, some people felt that if they contributed yearly to a donation to their ambulance service, that would justify the reimbursement or the payment of the ambulance service. There's so many definitions.
Oh, there are,
And
but,
there's so many definitions of, you know, what was it, medically necessary?
yeah, that's the key word. That's the key word. But, you know, most of the community area ambulances, you know, do have memberships, you know, so you pay $50 or $75 to be a member of your local, to support your local ambulance group. And typically what that gets you is they won't bill you for balances beyond what they get from your insurance company. So they're still gonna bill Medicare, okay?
Still.
To get their 80%. And if you have a supplement, they're gonna get the other 20% from that, okay? But usually what that gets you if you're a member is if they don't get 100%, they get the 80 from Medicare, then they're not gonna bill you the other 20. You'd have to check with your particular ambulance company that might service you, but the ones I've seen, that's kind of what that membership gets you. If you didn't have any insurance, I don't know if they would eat the whole thing, but. Yes?
I have a question I'm just uncertain about still. So I just turned 65, but I'm employed.
Mhm.
Is there some decision I have to make to not exclude me from anything in the future until such time, and I have a, comparable plan, or what's the term?
Yeah.
I have covered.
Yeah, creditable plan.
Correct,
So
yeah.
You're covered by a group plan at work.
Yeah. So is there something though between now and December, or if I'm not employed, or until that I have to decide something
Right, so
with Medicare?
as long as you're covered by your group plan at work and your company has more than 20 people,
Yes.
then you'll be able to continue on your group plan. And you don't need to sign up for anything for Medicare until you no longer have your group plan. So if you work to 80, then you don't have to sign up for any part of Medicare until then.
And I won't be excluded from any decision?
You won't be excluded, you won't have any late penalties, as long as you're covered by a group plan. Okay? Now, what you may want to consider doing is you may want to sign up just for Part A, which is the hospital coverage, which is free for most people, probably for you too. You just can't contribute to a health savings account. Are you doing that at
Well,
work?
yes, I am.
Okay,
That's
then
what I was gonna- I
then you
just
probably
heard about
don't,
that the
then you
other
probably,
day.
so you need to attend Medicare 101.
Yeah,
Okay,
because I saw there was a 7-month window for that, right? It's just
yeah, so that's a conflict you have, but,
Yeah.
so you may not want to sign up for A and just
Right.
keep contributing, but that's your decision.
Right,
But
right.
they'll explain that more in the Medicare 101.
Okay.
But you don't have to do anything,
Right.
and
Okay.
you don't lose any rights
Don't
or
worry
anything.
about that. Thank you.
Yes?
Do you sign up before you're 65? Or do you it on, like, I don't know? Or do you
Yeah.
wait for your birthday, or?
No, you can do the enrollment process
Mhm.
3 months before the month you turn 65.
Okay,
Okay, so it can be done online, ssa.gov the application's right online, that's the easiest and best way to do it. And while you can do it 3 months ahead, we encourage you to do that, because then you need to decide, do I want original Medicare, do I want Advantage plan, do I want which drug plan, so that gives you plenty of time to work with us and sort those things out. But it won't be effective until the first of the month of your birthday month.
Mhm.
Okay. Okay, well, thank you all for coming.
Thank
I appreciate it.
Thank